check my budget, man. If I'm in the green, I still ain't budging, man. Check my budget, man. If I'm in the green, I still ain't budging, man. Yeah, you hit me up and said you wanna see a movie. Looking at my budget app right back at you like, who, me? It's my presence, you will never get this. We got a whole backlog chilling on the Netflix. Didn't know that you had a money tree, but since you ballin' now, can I have some money, please? Who you trying to play? I can't do nothing today. This year I'm maxing out my savings and my work 401k. I used to hit the club in my 20s trying to ball out. My bank account the next day steady looking like it's fallout. Picture this, it's my old man starter kit. We got ourselves a house, so now I'm Thanos with the gardening. Invite us out, probably not, but we try. I'd rather pay that extra till my mortgage till we refi. Gotta stash some money hidden for a rainy day. When we old and wrinkly, we bout to have it raining. Hey! Check my budget, man. If I'm in the green, I still ain't budging, man. Check my budget, man. Ay. If I'm in the green, I still ain't budging, man.
Ay. Kids on the train selling snack packs. Dudes busting moves, wanting cash in their snapbacks. Asking that you give $1 or $2, but you won't do, cause you're rent due and you wanna spend too. Who knew? Got your spreadsheet up to date with all the digits and in it. Many limits exceeded. You bought ish that you didn't need and now you depleted. Your wallet bleeding, but you gotta eat, and so you mixing eggs and rice and sriracha. Your choices got you by the balls. In your younger days, had a pretty sweet job and the money paid, but then you had to go awaken your appetite for making melodies and occasionally doing a play. So bye-bye 401k, farewell to the bonuses annually. But that's okay if that make you happy. Just be healthy and budget responsible. Landlord, raise your rent. Check your budget, man. Souvlaki shop, charge you for sauce. Check your budget, man. Contemplating quitting your engineering position to be a musician. Check your budget, man.
Check my budget, man. If I'm in the green, I still ain't budging, man. Check my budget, man. If I'm in the green, I still ain't budging, man. Check my budget, man. Check my budget, man. Check my budget, man. Check my budget, man.
Got alleyways dusty, back streets are broken. Tokens of the past, tolerated about hoping for a brighter tomorrow. Green grass syndrome, it's drought time, so the lawns dry as a boat. Project a fantasy clap in another direction. Come to quench the thirst for a deeper connection. Eyes leap for a fleeting, we hold our breath and exhale with the current eddy on to the next. Steps remove dust, tread closer to something. The sky hangs low, and I'm hoping it opens, cause I need it now more than ever to bring rain, to wash away the stain, bring a state of change. What's the cure for that? Nothing. Still trying to find a way to keep buzzing. What's the cure for that? Nothing. Keep on until the world starts rocking. I can see something, maybe it's a source of light. Can't fathom the edges of if it's wrong or right. Like I'm drowning, trying to find down a rope, and my body aches, wishing for the world to stop. I'm getting dizzy and seasick. Nobody means what they speak. My life rough, sprung a leak, face down in the bath, scared of the death. Creatures of the deep looked at me and they wept. Dark eyes with the salty tears for all my fears. Be grateful for the little precious time you have here. Let go, float, reclaim my life from misstep to shipwreck all in one night. What's the cure for that? Nothing. Still trying to find a way to keep buzzing. What's the cure for that? Nothing. Past life path like domino mosaic. The beat keeps calling me back, there's no escape. So what's the cure for that? Nothing. There's too many toys for me to ever stop crushing. Be equipped, crippled, kryptonite. Cause these ass flag bearers made an Illuminati. People could try to trick you, they lie to themselves. Then portray a false mask and they say it's for real. Is it arrogance, ignorance, mental disturbance? Either way, didn't think I deserved this. The closest thing I've got to a cure for this malady is a pen and a book full of rhymes, rescue remedy. What's the cure for that? Nothing. Still trying to find a way to keep buzzing. What's the cure for that? Nothing. Keep on until the world starts rocking. What's the cure for that? Nothing. Still trying to find a way to keep buzzing. What's the cure for that? Nothing.
This one's for every beautiful has-been. The loves of past, future, and my present, presented to me delicately pressed into a memory. I can feel the brush inside my mind, painting what one might look like lying on the sofa and another just plain lying, a previous me crying for lack of proper goodbye. And it's also for you, every person with has-beens. You who filed old emotional baggage into recycle or trash bins. Which one goes where? I guess it depends on where it ends, if it ends. If there was ever really a chance that it's the end of summer, but we can still be friends. My mind is a bit of a museum, art everywhere, you might stop and stare if you could see them. Lucky for me though, you probably never will. They're not exactly painful, but still. I've tried so many times to pry the parchment down.
Hey, welcome to Blackbird. On this edition, we're going to be talking about, delving more deeply into privilege and what that might express itself as. So today we're talking about healthcare. We've got a couple of big points to make, and we'll discuss with stories and other things the disparity in healthcare coverage and whatnot among minorities and how that contributes to privilege.
Oh no.
Yeah. All right. But first, housekeeping.
Yeah, housekeeping stuff is basically the same. So we have a Facebook page that Megan moderates. So if you want to say hi to Megan, just go over to the Facebook page. There's a link in the description. If you have any ideas for like a topic or you want to know more stuff, like Megan's there for all of that, and she will help you. There's also a bunch of articles that we've used in this one. So there's a bunch of links also in the description. And next week on November 17th, we're doing another one, and it's going to be centered around education. And that's all I have.
Awesome sauce. So again, we've got Micah and Joe and Ashley. We're ready to give a wave.
Hello.
Hey. So we're starting our times are getting a little weird, mostly because I decided a lot of you guys aren't watching us live anyway. So times are going to be weird. If you have an issue with that, let us know. Hey, I'm here. Yell at me. I love to be yelled at. It's fun. So we're going to start with me, I guess. That's what we decided. So when we started talking about privilege and we broke it up into these different segments, I thought it would be really interesting to talk about COVID and the numbers associated with COVID and why that might be. So in the link, so I sent Micah a CDC link, and I think it's really important to note that the CDC is a government-run organization. So everything that I'm about to tell you, the CDC and the government know. So that's part of the problem. So here we go. So according to the CDC, Blacks specifically are dying from COVID at a rate of almost 2.5 times more than their white counterparts. Hispanics are dying about 1.5 times more, and Native Americans are dying about at least once more, right? So like for every 2, there's one of them, I guess. So, but I thought was really interesting, and this again is like something I saw on the CDC website, that they break it down into factors that contribute to why these populations might have increased risk. And so one, obviously, is discrimination. So like it or not, discrimination exists in all of our government and everywhere. It's everywhere. Discrimination is everywhere. Man, woman. Anyway, so what they're saying is that, but what I found interesting is that they talk about discrimination being a cause of what they call chronic and toxic stress, and then economic factors that put minorities at an increased risk of COVID. So if you think about, and I think, what do I want to say? So if you think about what I think people talk about this is right, like you have to reduce your stress levels, and like stress makes your body, like if you're under constant stress, then your immune system doesn't work the way that it's supposed to, and all of these factors. So if you consider that people of color and minorities are constantly dealing with discrimination, that's a stress factor. So there's this underlying stress in minority life that is a constant. And because of that, their immune systems are not as strong, and they're more likely to catch COVID. And then another one that they say is healthcare access, so and utilization. And so what they're saying there is that, so lack of transportation, someone watching your kid, being able to take off work if you work at a job that doesn't give you sick days or health days, or, the only days that you have that are paid are vacation days. You don't want to use your vacation day to go to a doctor, right? And so that limits access to healthcare. And then there's like language barriers, cultural differences between provider and patient that contribute to that also. And then they also mention that just a mistrust of the healthcare system in general. And they mention the Tuskegee study. If you're not familiar with that, that is when the government gave Black males enrolled in the military syphilis on purpose to see how it affects them.
What?
You should look that up if you have not ever read about that. It's the Tuskegee study of untreated syphilis in African American males.
Ooh.
Yeah. And then they also mention that there was a period of time where they sterilized Black women without their permission. And so, of course, that leads to distrust of healthcare, obviously. And then they also mention occupation. So minority groups are more likely to work in essential positions like healthcare, factories, grocery stores, restaurants. And then they also mentioned that like maybe transportation then is also part of that. Like if you don't have a car and you have to ride the bus, then you're more exposed to catching something, right? And again, with like sick days or being able to work from home, all of those things play into like occupation and like when you go to get help. And then they mention income and education, wealth gaps. Obviously, if you don't have the money to pay for a doctor, you don't go to the doctor. And then I thought this was interesting. So they mentioned housing in that, and like minority groups are more likely to have multiple generations in a household. Like your grandmother maybe lives with you, or your aunt or your uncle lives with you, and their kids, maybe like your cousins or nephews also live with you, and that contributes to, right? Like if one person gets sick and you go home, and your grandma and your grandpa and your aunt and your uncle and everybody else lives with you, and you all get sick, then you're just, then it's spreading, right, within your household and then your community. So I thought that was really interesting. that they broke it down like that. I also for me, it was just a little disturbing because this is coming from the CDC. So you're a government organization and you know that these problems exist and you're not doing anything about it. You're literally doing nothing. You know exactly what the problem is and you haven't done anything to figure out why that is. So this is just a breakdown of numbers. Here we go. And this I got from NPR. So this article was written in September, so it's November now. But so they talk about 7 million confirmed cases. And in the beginning, they weren't recording race, but now they have started to, and that's why the trend is becoming clearer that it's affecting minorities more than it is affecting anybody else. And NPR notes that the trend has persisted and in some cases worsened. So here are some numbers, and I would love to show you this chart, but you're not going to be able to see it because I'm phone. So they break it down this way, and it's kind of interesting. So they talk about population and then number of cases within that population, and then number of, or rather, not within the population, but so the population and then how many cases, total America, that population makes up. Does that make sense? So okay, and then how much of that population has died. But so the second two numbers are out of all Americans, and the first number is how much of the population they make up. Does that make sense? Sort of. Okay. So okay, we'll start here. So white people make up 61% of the population in America. Okay. So, but of the total population in America, 51% of white people have had cases of COVID. And then 44, again, of total population, of all of the cases, right? They're talking all of the cases in America, 44% of that is deaths of COVID. So I think all of those numbers sound really high, unless you take into the fact that they make up 61% of America, right?
Yeah, it's going to be a higher number because the starting number is so high.
Right, because there's more of you. So then now we go to this. So the Black population in America is 12.3%. So Black Americans make up 12% of America. And of total COVID cases, Black Americans make up 21% of cases of COVID, and then make up 18% of COVID deaths. And the Hispanic population makes up 17% of the population of America, with, again, 21% COVID cases. Of COVID cases, 21% are Hispanic, and of COVID deaths, 28%. And then they break it down. Asians make up 5% of America, with 3% of cases and 2% of deaths. Native Americans, and this is crazy. This number I think is particularly drastic. So Native Americans only make up 0.7% of the population, but they make up 0.9% of total cases.
Wow.
Which sort of means that almost every Native American has caught COVID. If you look at the number, disproportionately, they make up more percentage of the cases than they do make up of the total population in America. And then for COVID deaths, they make up 1.2%, which is, again, much higher than their percentage of population in America. So that one is like kind of the most drastic number. So if you say like they only make up 7% of America and they make up 1.2% of COVID deaths, that's like double their population. Like for the amount of Native Americans that there are, they're making up almost twice of the COVID deaths population, right? It's really crazy. So here again, more numbers. So African Americans get infected and die from COVID at rates more than 1.5 times their share of the population. In Missouri, Kansas, Wisconsin, Michigan, African Americans are dying at a rate of more than 2.5 times their populations in these specific states.
Huh.
And then Hispanic and Latinos their rates have gone up since COVID started. So in May, when they first did this, in May it was true of only 7 states, but now it's true in 19 states. So the Hispanic population their numbers aren't going down, they're going up.
Right.
So Hispanic and Latinos have a disproportionate rate of infection in 45 states. So the rate for Native American and Alaskan natives, the rate is 5 or more times greater than population share in Utah, Montana, New Mexico, and Wyoming. White deaths from COVID are lower than their share of the population in 36 states. So it is affecting, and again, I think it's really interesting to note that this is a simple Google search. Like this wasn't like last week where I had to like dig and find numbers and like, you know what I mean? This was a simple Google search. Like the CDC one and this one by NPR were like the first 2 that popped up, and there were pages and pages and pages. But I read these because CDC is the government and I trust NPR. I know there are people out there who don't, but I do. Yeah, that's what I found out about COVID and why, like, one, how it affects minority populations more, and maybe some of the contributing factors. I personally, I have had friends with COVID. Nobody in my family has gotten COVID or passed away from it, obviously, because no one has gotten it. Joe, do you know anyone personally who's caught COVID?
Yes, I do.
Family members or?
No, mutual associates that we both know. Of course, they will remain nameless. But they had all access to medical capabilities, medicines, or whatever type of treatment any regular, I would say, societal norm individuals would have access to.
Mm-hmm.
They were not asymptomatic, but very, very light. As a matter of fact, I remember coming across them in their vehicle one day. They were out and about while they were supposed to be quarantined. And, but they were in their vehicle and they literally, I'm not excusing their behavior, but I think they went and got something curbside and it was just like put in their passenger seat and they just happened to see me and stopped for a quick second and immediately went home. So I would say that that's pretty responsible. But yeah, no major issues or anything. Outside of that, I do not know anyone who has had COVID and had any type of inability to get it diagnosed or treated with whatever available treatments that there were. Not to say that that is not the case, because I know it to be true, but nobody that I personally know has had to just let it run its course, if you will. You know what I mean? It's like, well, we'll see what happens.
Ashley, what about you?
Probably nobody in the family, nobody in my family or any close friends have come down with it. I do know that one of my husband's, his boss, and I believe one of her children actually tested positive, and they quarantined and went through the whole thing. And that's about as close, I think, as it's gotten to my family, thankfully. Especially because my mom works in healthcare, so that's the whole thing of her really being careful. Like, she didn't get to see the kids for months for a while there when it was really bad, and now it's starting to get bad again. So we're kind of going back into the whole thing.
Totally, and I think like that's another thing that they mentioned is that like I think African Americans make up 30% of registered nurses in America, like male and female. 30% are African Americans, and then so that's a contributing factor to why the cases are so high among minority populations. Micah, what about you? Do you know anybody? Or
when you were talking, I was thinking, so I had like 2 white guys and then 1 black guy, and I was like, well, but I know more white guys than I know black guys. I think like 2 of the cases are pretty nominal, like stay at home. The other guy I think was more serious. It happened like shortly after we found out about COVID. He's fine, but I think it was more like more coughing and more painful.
I think of the people that I know personally, 3 of them have been minorities, and only 1 of them has been white. But that's my experience. But I thought it was worth, commenting on and asking. And I think it is worth noting that just because you don't know someone personally doesn't mean it's not happening.
It's true.
So, all right. Well, let's keep going. Let's get this party started. Kidding. Not party. So, Micah, you're next.
Yeah, so I wanted to do pregnancy despite not having any children, but I think women's healthcare is really interesting, and then you add on a layer of Black women's healthcare, and it gets terrifying and interesting. So overall, in the entire country, about 700 women die from childbirth related or pregnancy related or something in that vein. 700 women a year die in the US. And non-white women, specifically Black women, Alaska Native women, and American Indian women are 2 to 3 times more likely than white women to have complications and die from either pregnancy or childbirth. And I know like everyone's heard this, like the US is like the most dangerous first world country to have a kid in because you're most likely to die. And that is because so many minorities die, which is not something I realized, like not something that clicked until the other day.
Okay, yeah, that's really interesting. I didn't realize that.
Yeah, the numbers are skewed that direction because of minorities who die. And so like that's sort of terrifying. But also like the route that I went down is like, why does this happen, right? So there's a little bit like what Megan was talking about, like an access to healthcare, or is it stress on the body, or is it distrust of doctors? And there's that section of it, and reasons why that happened as well. But the sort of rabbit hole that I fell down was like, what if you make everything equal? Like, what if you take Black women who are well educated and have kick-ass healthcare and are making lots of money, and then what happens? And the news is it's not good. So I have two stories for you guys. One of them is Shalon Irving, and that's the NPR article. Is really, really good, and it gets into like depth of like her story and why this happens in general. So I'm just doing like a recap. So Shalon Irving was 36. She had a BA in sociology, 2 master's degrees, and a dual subject PhD. She worked at the CDC. She was an epidemiologist, and she wanted to. Her research was talking about how structural inequality, trauma, and violence made people sick. She wanted to expose how people's limited health options were leading to poor health outcomes. And she was specifically looking at kids and how their situations later in life affected their health. So she was well educated, she was paid well, but she was also in healthcare, right? She's working for the CDC, so she knows what's going on. She got pregnant, and then 3 weeks after giving birth, she collapsed and died from complications of high blood pressure. So somebody that you think would do really well, especially having really good insurance. The second person is Serena Williams, who in 2011, she had to have surgery for an embolism. So she knows what that is and what that feels like. So when she gave pregnant to her kid, she started having symptoms, and she tried to tell the nurse. So she got out of the hospital room, went to the nurse's station, and was like, "Hey, I need a CT scan and I need an IV heparin drip, so a blood thinner." And the nurse was like, "I don't think so. You're probably just in a lot of pain and you're confusing it." And she was like, "No, I seriously, I need a CT scan and I need a drip." And a doctor came in and gave her an ultrasound on her legs. And she was like, this is not cutting it. I need a CT scan. And they finally did it, and they found several small blood clots in her lungs. So you have Serena Williams, who probably has amazing healthcare and plenty of money to pay for these things, and is still being, and is a world famous tennis star. We all know who she is, right? And she's still having problems. And you don't want to be the doctor that killed Serena Williams. But
you would think.
Being educated, being famous, having amazing healthcare doesn't seem to have as much of an impact as one would assume. So then it comes down to so is there a problem with the kind of care that they're getting? And the articles I was looking at, particularly the NPR one, was yes, there's racism in healthcare. There are doctors who do not believe Black people or Black women specifically when they talk about the problems and the pain that they're having, or they don't address it early enough, Yeah, and so that was terrifying and fascinating to find out. I think the really one, it says education and income offer little protection. In fact, a Black woman with an advanced degree is more likely to lose her baby than a grade education.
Wow.
Yeah. That's the one that hit me in the face.
That's crazy. That's nuts.
Yeah.
That's nuts. So in regards to healthcare, I have sort of 2 stories. I totally forgot about the other one until yesterday. I was thinking about it. I do have a birth story, but the first story I have is when I was, I think it was junior year. Is that when I feel like it was junior year in high school. I dislocated my kneecap.
Oh.
You remember I walked around with that boot leg thingy?
Yep.
Months. So before I dislocated my kneecap, I was at work. I worked at the science place over the summers, and I went to reach for something, and there was water on the floor, and I slipped, and like I was like, like that hurts a lot in the knee, like that's weird. Um, and so I told my mom, and the next time we went to the doctor, my mom has always been, and probably because she knows, right? Like she has passed this down to me that like tell your doctor everything. That's their job. Go in and tell them everything that you feel like is wrong with you. And so I think she was trying to like to give me that self-awareness because she didn't come into this doctor's appointment with me. And I guess like to be fair, I was like 17. So she was like to make a list and go in and tell her everything, blah, 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 blah. And I was like, okay. And I went in and I told the doctor like all the things, and I mentioned my leg and that I had fallen and that my knee didn't feel quite right even afterwards. It didn't hurt anymore, but it didn't feel right. She left the room, and again, it's one of those things. So it's like talk about like intersectionalism, right? Like, is it because I was Black? Is it because I was 17? Is it because I was a woman? You know, it's all three or maybe one of the three. It's hard to tell, right? But she left the room and she asked my mom which one of the things I was complaining about was the most important. And my mom was like, all of them. I'm telling you about them. All of them are important. So she did, I think they sent me for an MRI. And it came back normal. But MRIs don't look at muscles.
Right, like the bones mostly, right?
Right, it's a bone thing. So my MRI came back that, you know, nothing was wrong with my bones. So then, I don't know, a couple months later, I was doing something stupid and I dislocated my kneecap. And we went to the ER and we did all of the things. At the ER, they asked me what my pain level was, and I was like, I'm crying, so it's pretty high. And they told my mom that I must be that I was being dramatic because my blood pressure wasn't elevated.
Ah.
My blood pressure has always been low. It's just my natural state is I have low blood pressure. It's normally like 90/60, which is like low. I don't know if you know about blood pressure, but like average is like 180/70. That's an average blood pressure. Mine has always been super low. So if I'm reading as average, it's really high. It's high for me. But yeah, they basically were like, she's probably being dramatic. There's like, I think they gave me Tylenol. And then and when we went back to the doctor, she was like, kind of, and more to my mom than to me. She was like, "Well, it's not my fault. Like an MRI wouldn't have shown that anyway." And yes, an MRI wouldn't have shown that anyway. But if you had listened to what I had said about what happened with my knee, then maybe she would have known that it was a muscle problem and not a bone problem. So that's my one story. And then my second story is that so when I was 25, I caught herpes. And then when I was 27, I don't know. It was a long time ago. Anyway, after I got herpes, I got pregnant. And I had a doctor. She took very good care of me. She was wonderful. She and I discussed whether or not I needed to take my antivirals all the time because it's like a class A or B drug, which is basically like if you don't need it when you're pregnant. When you're pregnant, if you don't need it, you shouldn't take it because it can affect your baby. I am very lucky in that I don't have outbreaks very often, and so I just didn't take the medicine while I was pregnant. when I got, so my water broke and we went to the doctor, or we went to the, birthing center, whatever, labor and delivery. We went to labor and delivery. And wasn't my doctor. The doctor on call for the practice wasn't my doctor. He's an older white guy. And first off, the first thing he did to piss me off was he came in and he was like, "You have herpes." And I was like, "Yes." And he was like, "Why aren't you taking your medicine?" Like, because my doctor and I talked about it and decided that I didn't need to take it. And he was like, "Well, you should be on it all the time. I don't know why you wouldn't be taking it." And left the room. And then he questioned whether or not my water had broken. He was like, "You probably just peed yourself." And I was like, "No, I definitely didn't. I don't just pee myself all the time." So while we were checking into the hospital, my water broke when I was at home. While we were checking into the hospital, a thing that you may or may not know about your body and your water breaking is that it continues to break. So your water breaks and you get a gush, and then the water builds up, and then you get another gush, and you just are sort of leaking water like a fountain. So while we were checking in, water leaking down my legs in the hospital. And then this guy tells me that I peed myself. Yeah, I've just been peeing myself for the last hour and a half. That's the thing. So that, and then then he started me on, I always fuck up this name. Ashley, what's the name of the drug to start your contractions? Pitocin. So he finally decided that yes, I was in labor, and then that my labor wasn't progressing fast enough, and put me on Pitocin, and then I was having severe cramps, but I wasn't dilating any. And thankfully, this asshole did not deliver Tiberius. But because of that experience, my experience when I had my daughter was vastly different. And I probably waited too long to go to the hospital because I didn't want to have that happen again. So I can understand why or how an experience affects the next time, right? So I had a really horrible experience the first time. So then the next time when I had my daughter, I was like, "Oh, no, we're not going until it is go time." I waited a little too long. But anyway, that's another story for another time.
A conscious decision that you were because it was so bad last time. I was wondering if it was an innate, your body is responding I don't know why, but I don't want to go until.
No, it was very much a conscious decision. I did not want to do that again. Yeah. It was because I think partly because I wanted to have a natural birth with Ty, and I didn't get to do that because of this doctor. And I didn't have the tools to advocate for myself, right?
Yeah.
Which is also why I got a doula when I had Anara, because you can know a lot of things and it still be hard to advocate for yourself. And so that's why I got a doula with Anara, because I was like, if it comes down to it and I'm not able to do it and I feel pressured, I need someone who can be by me and say, "Hey, remember, this is what you said you wanted." So that's why I got the doula also with Anara. But yeah, it was a very conscious choice. I did not want to do that again.
Yeah. I think that's the scary thing about going to the doctor, is saying I want to do this, questioning that or suggesting something else, and then you start to waver because you're not the one that went to 8 years of medical school, Yeah,
I'm not a doctor. You probably do know best.
But then that's what I was reading, and people were you should get a doula, because then there's somebody who is literally in your corner and also knows knows what's going on and understands probably much better than you do.
Yeah, and they understand your options. You know, they're like, okay, well, your doctor is saying this, but really, like, this is like, so when your water breaks, most doctors will tell you that you have to come in right then. What I learned, and when I was studying to be a doula, or I was thinking about being a doula, is that you have 24 hours.
Oh.
Your water can break, and you have 24 hours before labor starts, before there's a risk of infection, before things get serious. You have a 24-hour window. But most doctors will tell you to come in right away. And when you come in right away, then they push the drugs on you, and they're like, because they like, get it done, just get it over with. Like, we'll just do this drug. And then they give you the Pitocin, and then it sucks, and you're having all these contractions, and your body can't relax, and it can't do the things that it wants to do naturally. So then you get an epidural because you're in so much pain, and it just keeps building on itself. So you get further and further away. Not to say everyone has to have a natural birth, but if it's what you wanted, you get further and further away from that. And so that's why with Anara, I was like, I'm not going.
Some of the like anecdotal stories that I read, people were suggesting, or a couple women were like, I just brought my white husband to my appointments because having a white man in the room made my problems more real to the doctor. And like the doctor would actually listen to us. And then there was somebody that was joking about like renting out their white husband to go with it. Like they'll go with
It'll be fine.
But it's a real problem. And like in the NPR article, they did, NPR and ProPublica did a survey. And there was an astonishing number of stories of women who were like, this thing happened, and then I never went to the doctor again. Which is really scary.
Let's see. I know Joe's wife had twins, and they have a completely. I guess a question for Joe would be: do you feel like maybe they didn't treat your wife differently, but do you feel like you were treated differently by the doctors, or anything?
I would have to say it was probably typical husband experience. You know, just sit back, observe, don't say anything. You're going to learn something today. You know what I'm saying? But I will say that probably for the girls turned 2, you know, Christy was still this pre-pandemic and all that stuff. So Christy's going to work. When I'm home from out on the road or what have you, I do what I can. And there was one time where one of their doctor's appointments came up, and I, being daddy, just went and took them by myself. And I kind of feel like I wasn't being listened to that time. And I don't know if it was like you were saying, the intersectionalism thing, or it's like because I'm daddy and I'm new daddy, so this is it, or, you know, did it have anything to do with, you know, my ethnicity, you know, being biracial or whatever? And I don't know, but I didn't feel like I was being listened to. And Megan, you know me pretty well. That didn't go over very well, and we got on the same page very quickly. We got on the same page very quickly. And, ever since then, I haven't had a problem. Because we didn't go back to that particular doctor anymore. And our new pediatrician is just absolutely fantastic. But I that was the only thing, and I couldn't pinpoint it. I just don't feel like my concerns and questions were being met, even with the respect of just being a new father, you know, which is just a basic respect that I should have gotten anyway.
Right.
But it was almost dismissive. And we were not tolerating that in any aspect at all.
Say, Ashley, do you have any doctor stories? And I'm sorry, I'm gonna have to go use the bathroom. But Ashley, like any stories, pregnancy, any kind of healthcare situation where you felt like you weren't being
I guess it's not where there really wasn't but there was a difference between my first pregnancy and my second pregnancy because with my first, I mean, everything was totally different with my first pregnancy. Let's see, it was obviously my first pregnancy. I had never been pregnant before. I was working a full-time job, but the insurance was really like the insurance that they offered to kind of everyone. It was a franchise. So the insurance, the benefits were limited and more so limited than what I thought. As I soon found out when I went to my first doctor's appointment and found that basically I would almost be paying everything out of pocket because an OB was considered a specialist and it was not covered even though I was pregnant. So I'm not really sure what they expected a pregnant person to do. But
Not get pregnant, I guess.
yeah, it was a very, very strange situation. It's like, yes, you have insurance. Yes, you are paying for it. But this particular thing is not covered. So I ended up actually getting, I applied for I always get it wrong. Medicare?
I think Medicare.
One of those, Medicare. I applied for Medicare and I got it because I didn't have the coverage through my employer that I needed for my medical needs. And I also changed jobs because of it, but I did get totally, like I was approved for Medicare and had that within itself was a very interesting situation. I mean, doctor's visits were like cattle calls, like no exaggeration. Mm-hmm. I would go to an appointment and it was at the public hospital here in Dallas, Parkland. So, and it was new Parkland because this was recent. So it was really nice. It's state of the art, really nice facilities, very clean. But I mean, still, it was legitimately like a theater cattle call. It was like, there must have been 200 women all in a room waiting. And because I had some issues with blood pressure, because I had a little bit of preeclampsia and my blood pressure was slightly higher when I was pregnant. I had to go to a special clinic where every other woman who was on Medicare also had to go. And basically, when I made my first appointment, they told me, you should pack a lunch and probably some snacks because you're going to be there for a while. And I mean, it wasn't a joke. Like your appointment time was really just an idea. I still don't really understand why they even gave you a time. They could have just given you a window because you never were seen anywhere close to that time. Yeah. Not even, I would say, if you were like a very early appointment, like it was never anywhere close to the time. So I would have like, say an 11 o'clock appointment, and I probably would go back 1:30, and then I wouldn't be seen. Like I would get into a room at like 1:30, and then I wouldn't be seen until 2 or 3. So I would go from sitting in a big room full of women to then sitting in a room by myself.
Yep.
Just waiting. And but I wasn't, with the first pregnancy, I wasn't on any medication or anything for the high blood pressure. And I think that's probably what led to me having to have an emergency C-section. And there was a lot of things. I think it was just like that weekend, that Saturday, because I had
stress?
Sunday, huh?
Was it stress?
Oh, I was working 40 plus hours a week. Like, it had a lot to do with stress. And it was a very stressful night before because somebody had called in, like super last minute. She was very sick, like legitimately sick. So I couldn't falter. Like, I can't be mad at you. Like, you were legitimately dying. So please take care of yourself. So, I mean, we just got slaughtered on a weekend, and it was at a small little boutique store in the mall. It was Godiva. I worked at Godiva at the time, and we just, got slaughtered. And then everything that could go wrong went wrong. Like, the ice cream machine was jacked up. Like, we got overran with people. And we would normally close on a weekend with 3 or 4 people. So to be down to 2 and it just be nice weather outside and people are just out, like people were out. They were really, really out and it just was crazy. And basically what had happened once I delivered and once I woke up and kind of came around, they explained to me what happened. Basically, I had an umbilical rupture and I was essentially bleeding out. And when they opened me up, there was this kind of almost aliens-like explosion of blood. And and I had a blood clot about the size of an orange. So I hadn't been walking around with it for a long time. So they think that it probably occurred from me like just running myself so hard the night before. And it had probably occurred that day or that previous day. But it obviously was something that needed to be addressed. I mean, even when I went in, they kept me calm. I felt like they listened to everything that I had to say. The nurses were really nice. They basically just kept saying, oh, you're not going to deliver this baby today. You're going to go home. It's fine. Everything is fine. Basically, all the things that you would tell someone to keep them calm and not have them panic. Because truthfully, I think that they probably knew something was wrong. And of course, bedside manner, they're not going to tell, a pregnant woman on the verge of having a mental breakdown, that she's about to deliver her baby who is not really close to ready to being delivered. Because I was only 32 weeks, somewhere in there like that. So
yeah, it was really early.
Yeah, it was pretty early. Still all the 20s, so I'm thankful for that, but still earlier than he would have wanted to be delivered.
Yeah, 36. I think anything after 36 is full.
Yeah, so exactly. So he was a little bit early. But again, and when I went into the room, like there were more staff in that room than I've ever seen. And it freaked me out too, because like people were asking me questions and they were trying to calm me down. Like it felt good, but at the same time, I was like, every 10 minutes, there was another person in the room and the room just kept filling up. And it wasn't like, oh, family, friends, talking about him. No, these were like medical staff, looking at the sonogram, trying to figure out what's going on. People stepping out of the room to have discussions, coming back in, like, there was just a lot of trauma behind that whole situation, being wheeled into the ER and all that. But then on the flip side of that, with my second, I had my normal OB because my normal OB did not accept Medicare. So when I got pregnant with my second child, I had the good insurance from Godiva. And it was a totally different experience. Like she immediately recognized that maybe we should monitor your blood pressure. And I think after my second visit, when it was still a little higher than she would have liked, especially with the previous issues with my blood pressure, she immediately put me on a low dose blood pressure medication and set me up to see a specialist. My specialist was also super helpful. My OB, by the way, is a Black woman. And she's fucking fantastic. Like she is absolutely amazing. Like she was the first person to ever talk to me about IUDs. And this was years before, because I've seen her for years, but before I'd ever gotten pregnant, like when I was still, and I mean, she talked to me like a real person. And I would say, not that my other OBs haven't, she just talked to me on a much different level and gave me information that I don't think I've ever received from an OB. So I think that's one of the reasons I go back to her, and I was happy to have her deliver my child. But it was a scheduled C-section and literally was run of the mill, and literally no issues, no complications this time around. It was really well managed, and yeah, like that's about it. I mean, I feel like I got two sides of it, because one, I was I was on Medicare and saw that kind of what people because mine wasn't necessarily financial, it just was the circumstances. Like eventually I got a job where I was offered insurance, but at the time, like I still had 90 days on the job to qualify for the insurance. And then by that time, like I literally had already qualified for Medicare. So I couldn't really, I didn't have to change. So luckily I got to stay with that particular insurance because I didn't have to pay for it. So that was great too. That was really excellent.
Yeah. I say, like, I think like that too, I wonder like what maybe the difference is. So my doctor with Ty, I was on Medicare. And man, like those, that is no joke. Okay. Like I think one time my doctor was like, he was like, why are you taking this day off? And I was like, oh, well, like I have to go to the Medicare office. And he was like, okay, so it's just like a regular appointment. And I'm like, no, I'm going to be there all day probably.
Yeah.
He's like,
literally
well,
all day.
He's like, well, you can come in after. And I'm like, yeah, sure. But it's going to be like 2:00 and we close at 7. So
I won't be able to do much.
I'm not going to be able to do a whole lot. But yeah, that's no joke. But I wonder if that she was the difference is that so in that office she took it, but I don't think anyone else in the practice did. And I wonder if her I don't know, what do you call that? The other doctor in the practice maybe was like, man, another one of these Medicaid women. But it's interesting to think about now. I mean, it could have just been an asshole. Some people are just assholes.
Oh, absolutely. Because I know before I actually, what was it? It was with Forrest. I went to one other clinic and it just was that was a terrible, like I left that clinic in tears because the first doctor that I went to go see with the last company's insurance was, when we found out we didn't have insurance and all that stuff, then I had to go back through the process of finding a doctor. And I found a clinic that was close to where we lived. And it was just a terrible situation. Like one thing, I mean, I don't know if you experienced this, but I mean, just overcrowding. Like there were so many people packed into these offices. And I mean, you hear all the time about the Medicare fraud of people just trying to like turn out and get the checks. Like they knew, and this was the really, really crappy part, is that they knew they could not treat me, but they still booked the appointment so that they would get the fee.
Oh.
So I walked into the office and they fully knew. If they looked at my chart, they basically said, oh, based on your history and your BMI, you are high risk and we don't do that. So literally, I didn't see a doctor. The nurse walked in and was like, oh, so we're not going to be able to do anything today because the doctor just looked at your chart and you're high risk and yada, yada, yada. But they still get a check. So I'm like, why on earth, if y'all had my chart, if you saw all my information, why wouldn't you just tell me over the phone that you can't help me and I wouldn't waste my time sitting out there, filling out paper, thinking that I'm going to come back here and hear my baby's heartbeat. Because at that point, I don't think I did anything. Maybe. I can't remember. But I mean, it just still, like, it had either been so long between because of the transition in insurance and trying to find somebody. And like I filled out all this paperwork and the waiting room was just like stacked on top of people. Like Chris was there with me and I went into the room by myself. And as soon as she told me that, I just lost it. I was like, this is ridiculous. Like, I just want to make sure that my child is okay. Like, I'm aware that I'm high risk, which is why I'm here, because I need to see a doctor. And y'all are literally telling me that when my doctor sent over this information to you, y'all didn't look at it until I got here. It's just like I literally lost it.
Yeah.
Deservedly so. That's just sorry. Look, had me hot. I'm yelling at the phone on mute. Your story, Ashley.
But I mean, that's so wild. But literally, like, you could tell it was like, and not to judge anybody, but like it was in a lower income area, as packed as it was. Like, they are a Medicare clinic.
But it's a hustle, though, too.
Oh, no, it absolutely is a hustle. Like, I'm going to say yes to every single client that I can, even if I know that I cannot treat them, just to get the money, just to get the check.
Right.
There was one when I was looking for a doctor with Ty. There was one like right across the highway from my parents, and I was like, "Oh, that's super convenient. I'll go there." The waiting room was the size of like a walk-in closet. Like, and not like a fancy mansion walk-in closet, like a regular walk-in closet.
Yeah.
Like, it was not huge. And I remember like I opened the door because they said that they did walk-ins, and I was like, well, I need to, because I was trying to get on WIC and do all these things, and you have to like confirm that you're pregnant and blah 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 before you can get into these other programs. And so they said they had walk-in hours, and I like went and I opened the door, and I was like, nope, nope. Turned around and left. So, but yeah, I think that's a good segue into Joe's topic, maybe ish.
Great way to segue into.
Well, I'd first like to preface this by y'all are amazing women, including my wife, for having the children. And even though the experiences that you've had, negative, positive, otherwise, just y'all have my 100% support. I love y'all. That's badass. Second point, I'm going to be talking about an abortion audience. This does not reflect my or my constituents' personal opinions about abortions. I am just stating facts. That is all. Please do not read into the situation for more than what it is. Thank you. That being said, I'm just going to cite an article that I found. This is Abortion Restrictions Hurt Women of Color by Nikita Matre. This was written April 25th, 2019. I have multiple links that I found, but this is a great synopsis of just the information that most of them really, really went into a lot of detail over. This is short, concise, and it articulates my view pretty well. So no further ado, I'm just going to read the article. Thank you. Legislators and anti-abortion activists across the country are becoming increasingly explicit about their goal of overturning Roe versus Wade and prohibiting people from accessing abortion care. 2019 alone, more than 300 abortion restrictions have been introduced in states across the country, and 14 states have introduced or enacted extremely restrictive laws that would ban abortion after 6 weeks, before many people even know that they're pregnant. However, many women of color already live in a reality where they don't have true access to affordable abortion care. That's why for Minority Health Month this year, they recognize the disproportionate harm abortion restrictions cause women of color. Due to factors such as structural racism and discrimination, women of color face rampant income inequality and are more likely to be covered by Medicaid as a result. They are therefore disproportionately impacted by the Hyde Amendment, which bans federal funds for abortion care and Medicaid. Similar funding restrictions limit the ability of Native Americans who receive care through the Indian Health Service from accessing abortion. Explicit racism also creates barriers for women of color. For example, anti-abortion organizations have targeted Black women and Latinas with false and harmful rhetoric, claiming that the most dangerous place for an African American Latina is in the womb. And one of the main justifications for sex-selective abortion bans draws upon racist stereotype that Asian American and Pacific Islander women decide to terminate pregnancies due to preference for male children. Racist beliefs have no place in dictating who is able to access critical health care. Anti-abortion proponents try to peddle the notion that women of color agree that abortion access should be further restricted, but recent polling from Recent polling from National Asian Pacific American Women's Forum, National Latina Institute for Reproductive Health, and in our own voice, National Black Women's Reproductive Justice Agenda shows this to be patently false. A majority of women of color believe it is extremely important for women to have complete authority to make decisions about their bodies and their lives. Furthermore, 9 in 10 women of color believe that being able to control if, when, and how to have children produces both individual and societal benefits. Women of color's access to abortion care is even more critical when considering the pervasive health disparities they face in comparison to white women. In nearly all aspects of reproductive health, women of color face poorer health outcomes than white women, from maternal mortality rates to endometrial and cervical cancer. Additionally, women of color, particularly Black women, frequently have negative experience in healthcare system due to institutionalized racism and the history of control, coercion, and lack of bodily autonomy when it comes to their reproductive health and decision making. Healthcare providers and the system more broadly must embrace a race equity approach to reduce these disparities. Women of color already face layers of barriers in the way of accessing abortion care. These new restrictions only make it worse. They deserve more supportive policies that give them full autonomy in deciding if, when, and how to become a parent, not bad medicine laws that further curtail their choices. And then it just gives the link on learning more. Reading into that, a lot of the factors, and I know, Micah, you were more on the side of if all the obstacles that are faced in the lower income areas and things of that nature were the same, there's still that highly skewed number towards Black women still dying after giving birth or what have you. But in the COVID-19 case, and I believe in this, also in that as well, because I would imagine, despite the great education of Shalon and, the highly recognizable and indisputable talents of Serena, for the one young lady to pass away 3 weeks after giving birth, and Serena to know her own body and being told, no, you're just freaking out or whatever, that in itself is amazing. But for people of lower income who probably aren't in tune with their own bodies in that capacity or are that educated, to have the doctors dismiss, what their concerns might be, or to recommend a treatment that's not targeted to the issue that they may be describing, and then distrust, whether it be from previous experiences or just learning what has been done to the Black community as a whole through the years. It's very disheartening. And then on top of that, I have 3 daughters, you know what I'm saying? So that's why it's kind of important to me on a personal level, because I don't feel that people in power should be, and this is just my personal opinion on women's choice. This is my personal opinion. Do whatever is necessary, medically necessary, should be able to access and do. But on the point of Black women, it just goes to poverty and education, contraceptive use, and mistrust of the healthcare system that provides, these benefits. And if y'all have any further opinion on what I read, I welcome your.
So I just have a question. Is that in looking over this, did you find any numbers where it would say or prove that minorities are more likely to have abortions?
Yeah, hang on. It may take me a moment to get there. A lot of the numbers are skewed, not skewed, but you find in lower income areas that the aspects of youth, adolescence engaging in becoming sexually active at younger ages,
Hmm.
which leads to unintended pregnancies. And maybe in those areas, because a lot of the times the parents are younger than your average. So it's kind of like, well, if I get pregnant, it's just kind of the situation of where I'm at. You know what I mean? And so unintended pregnancy, although maybe not welcome, it's not feared as much as amongst their white counterparts who and I read this, so give me a moment to look it up. But it was stating that 60 something percent of white women between the ages of like 16 and 19, I believe, will really be angry and upset if they had an unintended pregnancy, where young ladies of color and minorities, I think it was like in the 40% of whatever, so it's not approached in the same way.
So I'm sorry, just to clarify. So what you're saying is like the factor of like having young parents or unintended pregnancies sort of being the norm in minority culture, that there's not the same reaction as like
that included with not great access to healthcare and the mistrust of healthcare professionals in their communities. Also, not really being educated about their opportunities with contraceptives, or even using them appropriately, even if it's just as far as a condom for that protection. A lot of the times they're not used. If they are used.
What was that statistic you told Micah and I earlier about condoms?
So in researching this, come to find out that condoms are very effective at preventing STDs, not as effective against preventing pregnancy. And across the board of just all people, if they're using condoms as their primary contraceptive, works about 50% of the time. 50%, maybe a little bit more than that.
So everybody out there, if you're watching this video, did you hear what he just said?
Still use them. 50% is better than just what you think that you can do on your own.
Sure.
Still use them.
There are other.
Solely rely on that. There are other options. Do your research, especially if you're going to be young and sexually active in a in not a stable relationship. If you're out there having fun, definitely do your homework and research your options of contraceptive, factors, things to research. You distracted me, Megan. Let's see.
I was just sorry. When you told us that earlier, I was just very like, whoa. Is the story that you're told is that if you use a condom, you will be safe and everything will be fine.
But the thing is people don't use it the right way. Like,
that is
you're
another
supposed
factor.
to ejaculate out of the orifice. You're not supposed to say, okay, well, I could just bang, bang, bang and stay inside of her. Like, that's not, no. It's supposed to occur outside. Because really what the condom's job is to do is to catch the pre-ejaculate, which could still get you pregnant.
Yeah, that's true. That's very true.
You just taught me. I didn't even know. You just taught me something, Ashley. I didn't know.
Yeah, like the condom is really, truly, its job is to protect you from getting pregnant from the pre-ejaculate. But if you orgasm inside of a woman with a condom on, it could leak out. Especially because nobody just like ejaculates or comes and just stops moving. Like, you continue to move, stuff squishes around. Like, it's not like we're all adults. Like, y'all know how it works. Like,
I feel like we're gonna have to put a trigger warning on this conversation.
Like none of our conversations are marked safe for children. Don't worry.
No, none of them. Yeah. But yeah, stuff squishes around. It literally is meant to catch the small amount of pre-ejaculate, and then you are to remove your penis from the vagina and continue your time expelling fluid from your penis.
Let's see. Okay. So here's one for you, Megan. It says the most striking disparities in contraceptive use are those in percentage of women at risk for unintended pregnancy who report using no contraceptive method. The most recent study, which includes data from 2006 to 2010, 17.2% of Black women and 10.4% of Hispanic women at risk for unintended pregnancy were using no contraceptive method, compared with 9.5% of non-Hispanic white women. Although there were no differences by education and income in these most recent data, previous versions have found differences by these socioeconomic variables, have not isolated independent effects of race. All right, so there's some numbers for you there. Using contraceptives, race ethnicity has also been found to be associated with decreased likelihood of using highly effective methods, whereas socioeconomic variables have not been associated with this finding. 14.1 non-Hispanic white women who use contraception relied on condoms, compared with 18.1 of Hispanics and 19.5 of Blacks. Although this analysis did not control for confounding factors, studies using multivariate techniques also found that race associated with the use of less effective methods such as condoms. Higher rates of condom use may be appropriate for the prevention of sexually transmitted infections, including HIV. They are less efficacious at preventing pregnancy. So there's just that one.
Yeah, that's really interesting. Just when you told us that, I was like, yeah, because I mean, I guess, and I think we all grew up with like, you wear a condom so you don't get pregnant. Like, right. Then maybe later, you were told you wear a condom so you don't get anything, right? Like that was the after message, right? Like the first message was you wear a condom so you don't get pregnant. The after message was so you don't catch something, right?
But it's kind of backwards. But I think the underlying thing with this is it just matters, the better opportunity you have to access healthcare and clinics, better standardized sexual education, because another thing that was come to light is that's not standardized across the board. Depending on where you go to school, is whether you have sex ed at all, if it's just minimum, or if they actually go into, going into sexual diseases and other aspects, how to get pregnant as far as menstrual cycle and, the week before, things of that nature. And so education with that and contraceptive education, I think one of the biggest things is the education and the access to medical facilities or whatever, because a lot of times in lower income neighborhoods, you got your clinic, like you said, you open the door and you're like, nah, I'm not sticking around for this. I got better things to spend my time on. And so unless you really, really have to be there for emergency situation or what have you, you're not going to stick around for that all day. You don't want to spend, God bless y'all for having to do that. But my goodness, 2 hours to get into a room, another 2 hours to get seen, and pack like sardines in a waiting room or what have you. I mean, God bless it, but there's got to be better ways to address this. And a lot of the things is with abortion, whatever the political landscape is, they address the restriction and, no, we're just going to make it that much harder to have an abortion. They don't address the underlying causes, from a socioeconomic, poverty, education, access to healthcare
why someone would choose that. They don't address that. They just address.
No, let's blanket it and just make it more restrictive to where you can't have an abortion after 6 weeks, and most people don't even know that they're pregnant by then, you know? Especially if it's unintended. You're not looking for that, you know what I mean?
Yeah. I think I heard stories from women who were, halfway through their second trimester before they realized they were pregnant.
Mm-hmm.
I think it's all over, as far as when like I say, I've had people not know until, friends, they didn't know until they were in their second trimester. I knew at 4 weeks, because my boobs hurt. I was like, that's weird. My boobs hurt.
Well, ours were planned, so yeah, we kind of.
And I think when you bring up education, that's a factor too, right? The more you teach women how their bodies could respond to pregnancy, then the sooner they might know that they're pregnant, rather than relying on a test or counting days. I can tell you in my 20s, I don't know, Micah, Ashley, when did you guys start keeping track of your cycles? Because I don't know.
Forever, always. I've always kept track of it.
Oh, really?
Oh, yeah, absolutely. Really? I've 100 trillion%. I've always kept track of them. I don't know why, because I've never been organized. I've never really kept track of anything like that ever. And I still really am not that organized in my life at all. But my cycle is always, I would say it really kicked it into high gear when I went to my first gynecologist appointment. Because I realized then that maybe I hadn't been tracking it so well. Because the first thing they ask you at any doctor's appointment almost is, when was your last cycle? And I was like, shit, I don't know. I should be tracking that. And so I think from that point, I've just always thought, I need to keep track of this in case I go to the doctor. And honestly, that's how I found out, how I realized I was pregnant. Because with my first one, my period came like clockwork. I never... I wasn't one of those people who, sometimes it was later, sometimes it was early. No, it was literally always the same. It was 5 days, always, through high school, college. I started my period in the 4th grade, and it has literally not varied at all. So when it did not come, and I knew that I had been engaging in the types of activities that would potentially put me at risk of being pregnant, it was a red flag, and I was like, well, fuck, I guess it finally gonna happen. And with my second child, my second pregnancy, with Henry, I didn't know I was pregnant. They're only a year apart, so I was still nursing. We were using 2 methods of birth control. So I would say overall I had 3 methods of birth control because I was doing the breastfeeding thing. We were using a spermicide, and I was on an oral birth control medication. But we were still engaging in the activities that it took to actually make a baby. So Henry really wanted to be born real bad. Real bad.
You wasn't no stopping him.
But I had heard that you could have irregular periods when you are nursing still, and sometimes you get it and then it goes away. So I was like, so I had one, and now I don't have it this month. It's no big deal. So I actually did not find out I was pregnant until much later with Henry, because I just thought, maybe it's the fact that I'm still, breastfeeding and pumping. So I think with Forrest, I found out at 4 weeks, because I had a period in December, and then it was literally the last week in January, and I was like, something is wrong. I should have had it by now. Yeah, and with Henry, I was like, I don't know. I guess maybe it's coming, maybe it's not. I don't really.
I'm gonna say you are the fact that you keep track of that is amazing to me. Am I going to the doctor? I'm like, when was my last period?
And literally all I do is I just put it in my calendar. Like the day that I start, I just put period start on that day. Just make a little notation on the day in the calendar, and that's
just,
it.
just not on. I mean, it should be on my list of things to do, but it's just not. It never has been. Like, I mean, birth control, not birth control. I never kept track. I still don't keep track.
You know what? I've learned something today. Something to pass on to my girls in case it's not passed on by anything else. So,
Yeah, track it. It makes your life so much easier. And also, if there's something wrong, you start to see like irregularities.
A
So if you're
pattern.
having issues, it's just one more thing you can add to the list of, hey, last month it was this many days, or it started like, and it's starting earlier, or it's going longer in between. Like,
look, I'm gonna have 2 of them, and they're gonna like be. I heard that when y'all together, y'all sync up. So
they're
trust
gonna
me,
be
I'm gonna be
raging.
tracking it for my sanity. But no, I will instill on them in them that that is a good thing just to keep track of for their medical needs and
And it, like I said, it literally is something as simple as sitting on the toilet and like, oh, okay, and we're all on our phones on the toilet most of the time. And like, let's be honest, like you're gonna be sitting there on your phone anyway. Just key it in and it's fine.
right on.
They even have apps that track it. So if that's an easier thing, like I think when I was on birth control, that made it really easy too, because like my birth control had an app that was associated with it. So it kind of logged my period with when I was supposed to take my birth control, and it all got wrapped in together.
Right on.
All right. I feel we may have gotten a little off topic here. But I do think we're discussing things that are good via education, right? The more you know your body and the more you know about how things present, right? So we talked a little bit about pregnancy, and Micah noted that women of color maybe don't experience symptoms the same way as other women. And we talked about COVID and access. And I think all of these things were, again, like, I think our goal here when we're talking about privilege is really to impart on to ourselves and on to those of you watching that it's all very related, right? So in this discussion, we talked about education, right? We talked about that being a factor. We talked about how your social economic, where you fall in the socioeconomical scale affects it. We talked about access. We talked about occupation. So you really see, even though we are talking about healthcare tonight, you see how there are other factors that play into how this affects people of color. And I think that's really what we're trying to get to the heart of when we're talking about privilege, is that it's not just one thing, right? It's an array of things that contribute to it. So maybe as a non-person of color, that better. Is that more PC to say a non-person of color?
You can just
maybe as a white person, you're like, oh, well, like I had a shitty experience, or I did da 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 da. And like, maybe as we break this down, or not maybe, hopefully, as we break this down and we go through these things, you see that you have areas of privilege, right? Maybe you don't have all of the white privilege. I think there are probably very few white people who have all of the white privilege, right? That's like top tier. But maybe you see that you do have some areas of privilege over your counterparts, your people of color, your brothers and sisters, with a little more melanin in their skin. And hopefully you start to acknowledge that, you start to think about that, and you use that to see and view the world in a different way. Because because that's our goal here. It's like not trying to make anybody feel bad. I don't want you to see, those of you watching, I don't want you to think like I hate Black people. Wrong word. I don't want you to think that I hate white people. I don't hate white people. Most of my friends are white. I have love for everybody. I think my goal here is to create an environment of empathy where you can understand how someone else's life and the way that our society is built affects people differently than yourself. And that's our goal here. That's what we're trying to do. I'm not trying to make you feel bad, right? I don't think that's anyone's goal in our group. Micah, trying to make somebody feel bad? Not today. Jill.
It's all your fault, people. Wake up. Just kidding.
Ashley, you trying to make people feel bad?
All the time.
Oh.
No, just kidding.
I hope you all know that that's sarcasm. So I think we're at a good wrap up, and I think we were ending our discussion. We're talking a lot about education, especially on Joe's topic, how that's like that is a factor, and it's a factor in all of these things, right? Education is a factor in, and not even just the education of people of color, but the education of the white people, right? So like if you are an educated white person, but you don't know that diseases present differently in different cultures, then how can you be an effective doctor, right? So next time on Blackbird, education and privilege. Yeah?
Yeah.
All right. Well, that'll wrap us up for today. I hope you learned something new. I learned something today. So we'll see you next time. Don't be a racist and wash your hands.
Get to know the problem a little before you try. Hey, form a team, you can call that. All I wanna know is where your squad at. Just define, don't attack, do a UNK, bring it back. Take it back to define where your charter at. Take it back to define where your starter facts. Take it back to define, let's make it smarter, cats. Take it back. Take it back to define where your charter at. Take it back to define where your starter facts. Take it back to define, let's make it smarter, cats. Take it back. I'ma guess where you messed up, beta. Where the plan at, better check that data. I don't care if it's mini tab or state, need to get on the same wavelength, beta. Hold up, better cap that track back, cause you said you don't even know where the map is at. So put a strap